think that's it.
Okay, I think so. So let's go ahead and you're gonna come over. And then you're going to assist him.
Okay, so
let's put you some gloves on. You need some gloves, and you'll have a hat and mask as well. So we do use hat, mask. I know there's a 6. That will probably work for you.
So you will start wiping it down,
Okay.
and then use the adhesive
If you need to.
Or-
The take home, I think, too, with using the adhesive remover is that you want to make sure that you do use a saline wipe also, because when you're trying to reapply, if that adhesive remover is on there, it's gonna be hard for
Yes.
that dressing to stick.
So to start off, we would start taking the original one off.
Okay, so go ahead. You can go ahead and
Okay.
take that off. And we have steri strips on that one, so I don't know, do y'all use steri strips on your lines? Okay.
Yes.
So you can take that off. And you could use the alcohol. I know this is a doll,
Yeah.
but you can use the alcohol to kinda, and something I learned, with these kinda have a release on them. I'll put it on my hand and I'll show you. If you, this helps the baby's skin. So if you put this on and I'm taking it off, like this, if you take the corner and you stretch it, it starts to release. That was a trick I didn't know right away. So if you take it and just kind of pull on it like that, it will help and it will rip the baby's skin.
It doesn't hurt it,
So you
Yeah, it
first-
doesn't hurt or remove, so just take it, kind of do like that, and when you pull on that just a little bit, it kind of releases. Yeah, so that way it's not,
So you stretch it first and then.
yeah, so I take the corner like that, and get it off my skin.
Okay, shit, Kelly, let me see that there. There we go.
Like this and kind of, and then it will lift easier.
Great.
And it helps protect the baby's skin, because remember, some of our teeny tinies don't have all the layers of their skin. And so we're pulling off multiple layers if we're ripping stuff off their skin.
Do you, before you remove the dressing, do you disinfect the area around it?
Usually we'll use alcohol to kind of get up under there and help loosen it as well. So not like right at the insertions, but just kind of around it to kind of help loosen it and get it to kind of come up.
But, I guess what I mean is like, do you prep with sterile towels or,
Yes,
and stuff?
yes.
And
This is
before
what-
removing the dressing,
We'll either use,
wipe everything else?
we have sterile towels, so that would be underneath them like this. When we do like just a normal tubing change, when the 2 nurses will do it, we will use a sterile 4x4 underneath.
Okay.
Great question. You have a lot of good questions.
Yes, because we do.
She's plastic, yes, so it's a little harder. It's okay.
Ow!
Yes, and so, that's the thing, you have to be careful. So usually the provider will make sure if you're pulling off the dressing, I have my sterile gloves on and I'm holding at the insertion site because that can come off, okay? Now we tugged too hard and look what happened. This could be an emergency,
Damn,
right?
I failed as a patient.
No, you didn't. No. She's a
It'll be hard on you.
But this brings up a very good point. What happens if this happens to you?
Did it
I would
break?
hold, yeah.
The
Inside.
catheter is broken.
I
And,
would hold
It went to the
entrance
heart.
and then-
uh-huh,
So you have to put a tourniquet?
yes. So you want to like grab and put a tourniquet around that site. Same thing with the umbilical catheters. I have had this in my career where we've all had them sutured in and got an order to pull it back a cm because it was in too far. And the good nurse I was like, oh, I'm gonna save these sutures, right? Because I didn't want them to go. And you start inching it back and it can slice through it. And I went, ah! And we got it. We were able to get, with the tweezers and stuff. But yes, that is an emergency,
I
a
think
cath
that
lab.
happened to
Yes,
one
they
of
would
the
be.
nurses a long time ago. And she also grabbed it,
Uh-huh.
Oh, yeah.
and then someone came and
Yeah,
they were able to take out the catheter.
yeah. So even though I want to say this is a routine procedure that we would do, always think about the worst thing that could happen when you're doing that, because if you think about those things, and that could be with anything with your patient, that way you're gonna be prepared. What do I do? What can I have at my bedside? I always have my second RN, my buddy that's, you know, right there close to me, to be able to, if I need help, they know what I'm doing. Hey, we're gonna do this dressing change, and then that's like okay, I'm on standby if you need something, okay?
My question is that, since I haven't done that much dressing change,
Mhm.
so overall, like as Annie said, so we first put the sterile drape under, and then we start cleaning it, right? And then we start removing it.
I would use, so here's your 4x4, right? And this is, the dressing was on, and you can clean like with alcohol. Just
Okay.
and really it's just helping you kind of loosen it. So you're using the alcohol and you're kind of extending that little, you know, upside
Only
dressing.
because you told us that with alcohol they bleed more, so that's why.
That's
why,
So
yeah.
this is,
Yeah,
She's
of course.
talking about outside the
outside the
dressing.
Yeah, of course.
If you use outside the dressing,
Yeah.
then it should help loosen
Okay.
it. But then once you have this, then you can use your Betadine.
Yeah, because I was just thinking that since I know it's like now the dressing changed, but since applying with alcohol, then it's because it's central line, it's more prone to
Yeah.
start bleeding again.
Yeah.
You know, so yeah.
It's typically also not as bad, like during a dressing change, it's had time to like build a clot
Yeah.
and heal. It's more during the insertion, like
Yeah.
when you're cleaning up after, you know, the insertion
think
that you don't want.
The hardest part too, because sometimes, so say it is that 26 hour and you're changing the dressing, if you have some like dried blood around it, then you're trying to get all that off.
Of
And
course,
that's when
yes.
you're trying to use the alcohol. So you're not necessarily using the alcohol right at the insertion where it would, you're gonna use the Betadine. Okay?
And then after you remove the tegaderm,
Mhm.
you wipe it with the.
So this is Christina, so you're gonna take your sterile glove, right? And he's gonna clean, so you're gonna hold, this is under the skin right there, so you're gonna hold that.
And then I start cleaning it with alcohol. Or with-
Betadine.
with-
Mhm. And that's Chlorprep, but I have Betadine right there,
Okay.
yeah. So you
So
don't,
I don't have to open it. I have
Yeah.
to say, like, so I open it and then I start like
And-
wiping.
so remember insertion, like use one swab for right at the insertion,
Okay,
and then get rid of it, and then take another one and circular kind of around it.
okay, so one for the insertion, and then that one you get rid of, and then you
Uh-huh.
do start doing a
Uh-huh.
circular motion out.
Mhm.
Okay, all right. Then after that, I wait for it a little
To
bit.
dry.
Then I get the saline
Uh-huh.
wipes, and then I clean it.
Uh-huh.
And then as she's holding it, then I put the
And you
take.
take it in on top.
Okay. And then wipe any excess cloth.
Yes.
Okay.
And then with tubing changes, we always wanna make sure that we take our tubing, and I'll show you with our tubing, that we change it up to the hub. Okay, always wanna change it up to the hub, so these you have to get new ones, okay? But we usually get everything primed, ready to go, and then we have a new one where there's just a cap on this, and then we're ready to put it together.
Wait, do we change those as often or no?
With dressing, with the.
With the dressing
No,
change?
no,
Oh.
with tubing change.
Oh, with
So
tubing
I'm just making a
change.
point that once you've got that, and then you're ready to do tubing change.
So let's say there's TPN, we change the tubing every day,
Mhm.
right? So that little hub, we don't change it every day,
You do.
the little connector.
Well,
Really?
This one.
depends on what their policy is.
Yes, yes.
Yeah.
Oh, it depends, okay. Because we don't do that, we just we change it sterilely, as sterile as possible. And then, but we never do the hub.
And not to the hub, we don't do that daily.
Like the little
Yeah.
connector, that one that you
Yeah.
just took
So
off
you
and on?
you wanna make sure that you guys follow your policy.
Okay, so it's every hospital's different.
Is it recommended?
We, we do it because, we follow the guidelines from the Nurse Infusion Society. And then this textbook is one of my favorite books, and it has a lot of great
Oh,
information
yeah,
in it.
that's a good book.
Yeah, it is a great book. So those are the kind of the references that we use. And so within our hospital, We also have, bigger kiddos and stuff like that too. So we have one policy that kind of fits all of our needs, and that's what we do.
So every day that you change out your tubing, you change out the adapters as well?
Would that be more
It depends on
I would
what's
just
going
feel that that would be
A higher
more
risk?
higher risk of introducing.
because you're
into
opening the
line.
circuit, like you're opening
Yeah.
for infection?
But I will tell you that we are over 560 something days CLABSI free, and we've been doing it for a good couple of years now.
I know there's other units who do not change that. It's not uncommon for people not to change that connector.
Yeah.
We also don't change, if it's just TPN, we change our tubing every 3 days instead of daily.
Oh,
It
no.
depends.
See, we do it daily.
It depends
Only
on,
if it has lipids do we change it every 24 hours.
yes, it depends on what's going through it,
Yeah.
decides how often we change our tubing. But
Yeah.
we have a lot of babies that have lipids, and so that, it's a very common occurrence for us to change it every day because of that.
I think the only time we don't
Well,
change
based
it
on
daily is
those.
if it's like a clear fluid, like
Yeah.
D10 quarter or.
That can go to 96 hours. Good with the dressing?
Yes.
Okay.
Yes.
So our next thing, you did great.
I was giving a round of applause.
Now you're getting hot, yes, y'all can take that off. So our next thing is, you wanna do the tubing change with me? Okay. So, just kinda picking up our mess just a little.
No, I really stand.
Do what? We don't like the 1.2s as much because it's like a thread. And I can tell you from Brenda's experience,
Hey,
they're
Kelly,
hard.
what was the question again?
The question was, when do you use a 1.2 catheter?
Okay.
So this is a 1.9 and this is a 1.2. So this is probably reserved for less than 1,000 grams. We've had some 800 grammers and 700 grammers and stuff that we have used this one for. This one, do y'all have a smaller, yeah. And we try truly to put a 1.9 in all of our patients because, we want to make sure that it stays patent and all that. So it's really reserved, and that's one of the reasons we went to the Argon brand. So we use the Footprints one, but this is the Argon brand because they make the smaller one, and we take care of those teeny tinies. So, okay. Here's your TPN. So you have your TPN, and now you have, I'm gonna put a little dressing on this real quick so that it looks right. Do you wanna show them the components of our
Or tell me what you guys use when you hang a bag of fluid.
What we change?
What all do you
We'll
add
have,
to it?
filters.
You have your infusion set?
Yeah, and like the tubing, and then you depending on what's needed, whether you use a double lumen, tri-lumen, or no lumen at
Okay.
by the baby.
Okay,
Everything has a filter, or pharmacy will send up a filter for VPN and lipids.
they send it up. Okay, this one has a filter. We have to attach this filter separate, but we have that.
What size filter do you use for your TPN and your lipids?
Anything as tiny as that.
So they look, I've been a few places and they do look different, so.
They're bigger than
Okay, so
Like the
I've
blue
seen-
one or the white one?
Yes.
We
Yeah.
have those too.
We have those two,
Yeah.
and so what you want to take notice of, this is a 0.2 micron filter. And the blue disc ones, they make a 0.2 micron filter. So it's just a different look. This was our older one, and we do have those blue disc ones. The 1.2 is for lipids. It's a bigger one because there's bigger molecules that have to go
No,
through
I
it.
already checked the actual size, but they
So-
look the same with
It's
different
1 point
colors.
something, I can't
Yeah.
remember the second one.
Yeah, so next time you change your
But it does make a
tubing,
difference.
They used to make one
It makes a
blue and then
difference.
one clear as well too.
So-
It won't go through, like the lipids won't go through the other one.
yeah. So take notice of when you're pulling your filters, okay?
Okay, so it has the filter, this has the trifuse on it, like we would do, and then we add an extension set that goes from the trifuse to the baby, just to give a little bit more space and less weight right on the baby. So obviously do what your norm is, what your routine is, but that's what we do. Just so the weight of this connector isn't pulling right on the line. That's the only reason we do it.
So I'm prepping for this tubing change, okay? You wanna connect it to that one, and then we'll just say that now we're unconnecting. So I have, my hat and mask on and my gloves. And I need more alcohol. Okay. So my partner, Linda and I, we do 2-person tubing changes. Do y'all do that here?
No.
Okay. So that is one of the quality things that we have found that has impacted the care of our patients, because it's 2 eyes on the site, and if I contaminate something, she's gonna tell me. Okay, I think that has really been very beneficial in our CLABSI-free endeavor marathon that we're on. Our journey, that's right. Okay, so my sterile gloves are on, and like I said, I'm going to take sterile 2x2s, and I'm coming over here, and I'm gonna take this like this, but I'm gonna change my gloves to grab that. So I'm scrubbing before I even open this line. Scrub, scrub, and I will probably use 2 or 3 of these alcohol pads. Scrub, scrub, scrub. I'm gonna get that squeaky sound for you.
How long do you scrub?
So she gets the squeaky sound.
Yeah, until I get the squeaky sound.
Okay.
Maybe 20 seconds. I mean,
it should be about 20 seconds.
yeah, something like that. Okay, and then Linda's got her gloves on, okay? She's gonna help me with the new equipment. So we've got our new line and everything like that. So I'm taking my, I will, at this point, it's nice, this is my 4x4. I'm going to change my gloves because I touched it with that alcohol. So I have new sterile gloves on. I have my sterile 2x2, and I'm gonna take it, and now I'm opening it, and I'm dropping my old stuff. Okay? Sorry. Now,
And we can do that.